So I'm a surgeon. I've been in a mask for 40 years of my life. And until now, until 2020, I never heard that masks made a difference to viral transmission. This is a new narrative. Now, you know, I'm going to tell you, I think this is a nonsense narrative, and you don't need a medical degree and you don't need a lot of science background to figure this out. A little common sense goes a long way. Now, this is a little meme I got early on in this whole thing, and it shows a guy in an ear loop face mask. This is the kind of mask that we're being told you have to wear in the hospital for the protection of patients and yourself. Here's the guy who's doing drywall. He's putting up, you know, the same thing that builds buildings. He's putting up drywall, and drywall particles are 10 microns. Okay, the coronavirus is 0.1 microns. You can see what this does to drywall. Do you really think, and the beauty of this picture is that we can see drywall particles. The problem is you cannot see the coronavirus. But this is very obvious. And it's not just that it's getting through the mask. It's not protecting you at all. But look at where it's going. The mask is actually acting almost like a Venturi effect, and the particles are around the guy's nose. And I'm going to talk about later, that may be pertinent because we're finding out mask, I've said before, I said the strongest argument for mask wearing is it sounds good. The strongest argument against mask wearing is it doesn't work at all. But it actually might even be worse than that. Now, this was sent to me by my friend who's an anesthesiologist, and this is the box the mask came in. By the way, you have boxes similar out there. I just read the same thing. And it says right on the box of these ear loop masks, these masks do not provide protection against COVID or other viruses and contaminants. It's not like we've never looked at this before. You know, OSHA knows about this. Now, size matters when it comes to viruses and masks, okay? So just to put this in perspective, what we're dealing with are the smallest groups of viruses. We're not saying masks don't work for everything. Masks were designed basically for tuberculosis. And they work for these things. Tuberculosis is a big globular mycobacterium, but it doesn't work for these tiny, tiny viruses. So coronavirus is in the family like rhinovirus, adenovirus, influenza. These are the seasonal respiratory viruses that come around every year. And the one you should look at, smallpox. Okay, I got interested when I was on a committee looking at defense stuff. I'm worried about smallpox. Smallpox is the most deadly disease known to mankind. Now, in the 20th century, smallpox killed more people than all the wars put together. I think if we could have masked it away, we would have done so. Unfortunately, and that's a bigger virus particle than this. So, next. This is just an overview of masks. You have to have a mask to get into Costco. That's why it's the Costco approved mask list here. So, the guy on the left is the surgeon, and we're going to talk about surgical masks. Surgical masks really are for two reasons. It's to prevent blood and fluids to splash on us, and it's to prevent us from accidentally drilling in the wound. I love the mask on the top. That's an OSHA N95 mask. So there are two types of N95 masks. The one on the bottom is a medical N95 mask where it says TB. The one on the top is the OSHA N95 mask, and that's for industrial use, like the guy doing drywall. Now, it's great. These masks are rated to filter out 95% of 0.3 or bigger micron dust. But that's a one-way valve. So, you know, if you think you're protecting your neighbor, when you blow out, you're just blowing out whatever you have in your system out to the air. In contrast now, this is a very serious mask on the bottom, the TB mask there. That's what we're putting nurses in now for 8 hours a shift in the ICUs. And I'm going to tell you, these are somewhat hateful to wear. I probably had to wear one 3 times in my life for surgery. It's not very common. But people that you suspect of TB, you wear this mask. And here's the thing, as a physician, here's what we do. When you're in the hospital, these things come in sizes. So it's not just you just put them off the shelf and wear them. Your size is sized to you, just like shoes. You're taught by the infectious disease nurse how to put them on, and we know how to take them off sterilely so we don't contaminate the environment around us. You know, what do we see people doing? They take their masks off, they put them on the dinner table, put the phone on it. I mean, this is not going to get us anywhere. Oh, next slide, sorry. And the other masks, by the way, they're just screening out common sense. Now, you know, we're cutting off my slides, unfortunately, but this is the first myth of mask wearing, is that, oh, you hear this all the time. Oh, I know that it doesn't screen out everything, but I'm sure I can tell it's screening out I'm not coughing and sneezing on people, and that must make a difference, right? That's a myth. Okay, next slide. Here's, I got this from Patrick Wood. I got this by permission, but anyway. So this is an anesthesiologist, Dr. Todd, and he's vaping in a mask. Now this is a surgical mask, and I'll make this surgeon's joke that he's an anesthesiologist, so he's wearing his mask too loose. I've got an anesthesia. But I'll go back one, you went too fast. Okay, so this mask, you can see, it does exactly what we're told to do. Okay, it screens out, it's keeping that surgeon from spitting anything into the wound. Nothing's going out to the front, but what's it doing? It's going out to the sides. And I can tell you that even if you tighten up that mask, it will go out to the sides, right? And I know this because when you're a medical student and you're taught how to behave in an operating room, what's the first thing they do when you're supposed to, they teach you how to sneeze. You know, people might not think about that. But you're holding a retractor and the surgeon's doing his thing and you can't move and now you feel like you want to sneeze. And what you want to do is you want to go like this and get as far away from them as you can. But they tell you don't do that because you'll blow out the side of your mask right into the operative field. So we know these things they're not hermetically sealed. They do not even collect sneezes. And so think about, the other thing is Dr. Blaylock points out in his video that this comes from. Think about walking down, they hand you one of these masks to go into the ear loop mask to go into a grocery store, right? But think about what you're doing. If you really were infectious, you'd be walking down, all this plumage would come out infecting all the aisles of food. So now let's go to the next mask. Now this is more the kind of mask that you see people walking around with. I don't know about you, but I've never seen one of these masks until the COVID outbreak. This is something that industry is now at least making a profit on by making these masks. And they're a more form-fit cloth multi-layer mask, right? So what you see here is he's vaping in this mask. It now is not leaking around the side. But your breath is taking the path of least resistance. It's going right out the front. So how protective is he? And also, remember the Chinese saying, it gets into your eyes? Is he protecting himself? Okay, now somebody sent me this little meme on the right. It says, this is what virologists wear to protect themselves from virus, but don't worry, your bandana works too. So I got that, and I thought that was pretty funny, but I said, you know what? I want to look and see what the really latest is in the viral weapons lab. So I looked at Winnipeg, which is, by the way, is a key player in this whole thing, I think. And Dr. Xi from China, who's now somewhere behind the bamboo curtain, who's also a key player, that's her, sitting at the Corona lab in Winnipeg, and I actually ran into somebody that knows that's her. Anyway, and that's what she's wearing. Now there's the actual coronavirus lab in Wuhan. Okay, they're not wearing bandanas, they're not wearing masks. They're taking that's what real virologists do because they can't be protected otherwise. Now let's hit the next one. Now here's the second myth of mask wearing. And this is actually, I read this by, this doctor is actually an infectious disease doctor out west. And I read this was in like not a medical journal, but just a newspaper or something. But she says, by having a mask over your face, it filters out the majority of viral particles. So even if you do get exposed to COVID, you're going to get very little virus in. And if you get COVID, you'll get less sick. You know, that violates what her own literature is saying, okay? I mean, the principle that there's less virus, less illness. We actually used to believe that took a lot of virus to produce an illness, but that is a flaw based on the way we used to do the testing, the serious science. But now we believe, and that's in her literature, one influenza droplet can cause you to get the influenza, and 6 adenovirus. So these are very, very small numbers. We're down to, basically, it's one particle can give you disease. But here's the next thing about it actually filtering out the majority of particles. In addition to what I just showed you with Dr. Todd, let's see the next slide. Serious scientists did things like this. This is from the Maryland Institute of Applied Environmental Health in 2013, and they actually put people with influenza in a hermetically sealed container. They put them in different kinds of masks and they had them breathe. And a couple things that comes out of this and some other similar studies. The first thing is, yes, it does keep the big particles in, okay? What gets out are the very small particles. And here's the catcher. When they actually cultured these things, they found the big particles don't have live virus in it. It's the tiny particles that have the live virus in. So your mask is saving yourself, you're saving all this dead virus, and you're letting the live stuff go. And yeah, so the next slide. Now this was also reproduced in a less technical way. Dr. Kim in South Korea, he had COVID patients. He put them in a special hermetically sealed room, certain ventilation, and he had them cough repeatedly into an area, standard distance for petri dishes or environment or viral media. And he did it with a surgical mask, cloth mask, no mask. And although there was a little bit of diminution in the number of actual cultures that grew, it wasn't appreciable. It's not going to stop people from getting infected. Whether you were one or not, you coughed out infectious material that we could culture in a real world scenario. Next slide. Now, if you're going to read one article on masks, this is the one I would read, okay? Dennis Rancourt, and you know he's probably right because he's being censored. Dr. Dennis Rancourt is a former physics professor at Ottawa. And physics, fluid dynamics is part of physics. And he looked at the fluid dynamics of air and viruses. And what he showed is that these little particles that we're talking about, these little particles, they are in part their air fluidity. They're all around us. We live in like a fishbowl of viruses all around us. And that they don't settle by gravity usually, and they bounce around things. And in fact, so here's his point. If the virus, even if you believe that masks work 100%, if you're surrounded by viruses, quote, even the slightest momentary facial misfit of a mask renders the mask or respirator entirely irrelevant. Okay? And this is a poster that when this came out, now this is what they want you to think the world is like. And when this poster came out, my first reaction is, that's not science, that's a made-up number, because you don't get science that gives you a number like 6 feet. And you can see how the only thing they've got right here is that the big particles are dropping out as you go across, and the small particles go a little farther. But see how they magically dissolve before the blue guy? It just doesn't work that way. And I was right when I said this was made up. So another physicist, Lydia Baruba, who's at MIT, and she is a fluid dynamicist, she did a study, and she showed through high-speed film and a bunch of other things, she watched this stuff go out from just people breathing 27.2 feet. Now that's a real number. You know, that's something I can believe. So this is just nonsense. This is the way the world really works. Well, this got cropped off, but it's supposed to be a big black screen with lots of little white particles that actually are the viruses, and you're standing in the middle of it, okay? And so, quite frankly, now let me back up and say, as we've heard, that doesn't mean that because masks work, there's nothing else. We've already heard there's early treatment. But the other thing is, we know that environmental mitigation works. I mean, humidity works, UV works, air circulation, lots of things work too. Humidity is huge for dropping viruses out of the airflow. So we know about environmental changes that make a difference. But this is just, come on, you don't need to be a scientist to realize how silly this is. This is what you see people all the time. My husband, last night or 2 nights ago, went in to get some takeout food in a restaurant. He sat at the bar, and the bartender says this to him. He says, isn't this stupid? You have to wear a mask to come in here, but then you can immediately take it off and sit at the bar or sit at the restaurant. How can this, you don't need a science background to understand that that's nonsense. I mean, they can't be doing anything. Now, there's another myth out there, and we've got tons of literature that show these things work. I've actually tried to look at that literature. And I found that it falls under 2 categories. The first category is lots of studies that show that masks screen some particles. And they give you a lot of stuff that sounds very good about how they screen particles. But again, and I just showed you, that's not really relevant because it's not screening enough particles to make a difference. And it's not screening the right particles. But then there's a new class, and because they haven't had studies that show it makes a difference where it really counts. What we really want to know is, if I wear masks, does it change the course of the illness? Can we see a real epidemiologic impact here? And so they tried to do this with this article. And this is right up what Dr. Todar was saying. I think this is not just bad science. This has been criticized. This is in the Proceedings of the National Academy of Sciences, peer-reviewed, very heavy-shooting journal. And, it's been roundly criticized by other people that looked at all the details. But I can just say, it could not have been, this is beyond just being bad, sloppy science. This is actually fraudulent. Here's a curve, and you've heard previously about the curve of seasonal illness. You just saw one. Dr. Urso had this curve of seasonal illness. So they're claiming, these people who wrote the article, that all that curve is a result of what they did in New York City. See, social distancing didn't work, so the curve went up. Stay at home kind of worked, so the curve flattened out. Masks really work, because they're pushing the mask. Masks really work, so see, the curve went down. But watch this. This is the Sweden death curve. It's the same downslope, okay? Sweden had 6,000 deaths. The worst death place to be in the world is in New York City. So, and I could put up France, I could put up Nigeria, I could put up Arkansas. They all have seasonal death curves. So to say that that is, that's such a blatant scientific fallacy, a philosophical fallacy, the idea that because post hoc ergo propter hoc, because something happens before something else, it caused it. I mean, I was born 2 weeks before Eisenhower was elected. I don't think I got him elected. Let's have the next one.
It might
And
be.
there's lots of literature about this. Okay, but here's one of my favorite pieces of literature, just came out from the CDC this summer. And this is in May of 2020 in their own journal. And what they were looking at was influenza, which is a very similar type of virus, the way it spreads, etc. Same size. And they tried to look at things they could do to curb community spread. And they looked at mask wearing, hand washing, and disinfecting your environment. And guess what? None of it made a difference. Next. And this is the one, the CDC says this is the only randomized controlled trial of cloth masks. It was published in the British Medical Journal. And this is interesting because this kind of brings me back to that first picture of the guy with the drywall. They looked at cloth masks, and this is in hospital workers, by the way. This is in the hospital. And they looked at surgical masks, cloth masks, and nothing. And what they found is, you can see the penetration rate of the masks. I mean, they're not really doing a lot. But when they looked at people who assiduously wore the mask, their relative risk of getting a viral illness was 13. In other words, they were getting sick 13 times more than the people not wearing the mask. Now, I can't completely explain that, but it goes along with some other things we're seeing, and I think that that's a problem. Let's go to the next. And this goes along with what just came out. This is from the CDC from July, and they show that 85% of people that have COVID, that came out with COVID in July, reported always or usually wearing a mask. 85%. 3.9% said they never wore a mask. And it's about the same in the control group. So another big myth here is that there's no risk to mask wearing. And I'm going to tell you there's a lot of risk to mask wearing. Not the least of which is your carbon dioxide buildup. Okay? Now, actually, I found out something looking at this, that after 4 hours in a surgical mask, older surgeons have some cognitive deficits that they've discovered. I guess maybe anesthesia is removed, but this is the OSHA standards for carbon dioxide buildup, or carbon dioxide levels in our atmosphere when we're working, and their upper limit that they'll accept is 1,000. I have a friend who's an internist. She puts little monitors in masks, and she found 10,000 in these highly restrictive masks. If you're having any chest pain, I highly recommend you take the mask off because you want the best oxygen and lowest CO2 you can get. But here's what really bothers me is the highest risk of masks. We have a generation of children that we are terrorizing. We're putting them in masks. Children learn to be human beings. They learn to grow up and socialize because they can read faces, and we're taking that away. And we're giving this inchoate fear of the world around them. You can't explain to a 4-year-old, I'm not going to go crazy if you put me in a mask. But this is damaging a generation, and this may waft into the next generation. This is not, we have to stop it just for this. Next slide. And in a moment of clarity, Dr. Fauci said he wears the mask as a symbol of good behavior. But let me tell you about, this was another physicist who's at a big famous institution, and he pointed this out. I'm from railroad country, and when the Chinese came over to work the railroads, they were Han Chinese, but they came over with this Manchu Q. It's called the Manchu Q, that braid. Why? Hit the button again. Because they were conquered by the Manchu, and as a sign of submission, they had to wear that braid. And then he put up the mask. Anyway. And then Dr. Fauci said, masks aren't really suitable they're not suitable for providing medical care to patients, i.e. they don't really work. But they do remind people not to touch their mask. To echo the last speaker, I find it just disgusting as an American that believes in liberty to think you're going to mandate I wear a mask so I don't touch my face. Let's think about that. And here's all you need to know. Mandates are for us little people because the city of D.C., they exclude their people. Wisconsin governor exempts there. I think Ohio, Kansas, a bunch of governments are going to find it's just not practical for all their workers to be in masks. So they're exempting themselves. I don't have a problem with that. Just exempt me too.
Yeah.
And FDR said in politics nothing happens by accident. If it happens, you can bet it was planned that way. So it's no myth. And I'm going to conclude here. Masks don't control viruses. They control you. And Biederman was a psychologist that looked at the Korean War veterans that had been in prisoner war camps, and he showed this whole idea of brainwashing was simple psychological manipulation, and one of them was enforcing trivial demands. I can't think of something more trivial than this. Mm-hmm. Now, you may think it's just a mask, you know, and that's why I'm here talking, because I have the next generation, my boys, I don't want them to live their life in a mask, because it's not just a mask. It may be soft like a ballerina slipper, but what it actually is, it's George Orwell's boot on the human face forever, unless we take this off now. So, thank you very much.
Dr. Merritt. My goodness, thank you so much for bringing such clarity to this subject. I'm a physician like you are, and I'm also an attorney, and the civil liberties aspect is actually why I started to speak out. It's so frightening what's happening. I just want to go over a couple of things. You're a surgeon, you spent your life in masks. So you said a lot of things here. One is that, you know, even if the mask is worn properly, you show that the smoke escapes. But I want you to reiterate again, the ones that they're now selling, that people are wearing, like bandanas, or the new ones that are covering, it goes out forward.
It goes right through the mask, because, and this is the problem of the golf ball going through the tennis net. And they try to downplay that, but you can demonstrate it. I mean, I was at an unmasked rally the other day, and a guy who does industrial arts just brought some dummies, and he showed this very simply. This doesn't take high-level science to do. It goes right through the mask. It's just a principle. And one of the things I didn't mention is that when they did the testing, even worn properly, when you cough and sneeze, you exceed the flow that those masks, those N95 masks, are rated for. And they recognize that now.
You made another really important point. I think it's logical. It seems common sense to people to think, oh, if I have less virus, I have less chance of getting ill, which is why we scientists believe that for a long time. But again, just to reiterate for everybody, you know, yes, you might capture viruses that are attached to, you know, a spit droplet, right? But other viruses coming out. So again, you just need a little bit of virus to get sick?
Just need a little bit of virus to get sick. I mean, really, again, this is about your personal immunity and the world around you.
Right.
And, you know, and to me, this using masks is like, this is the metaphor, I think. You don't want your house to flood, and you've got a bunch of houses in a floodplain. So you're going to build little domes around every house. No, let's just do the upstream dam. Okay? So that's what the problem is. We're trying to mask off everybody in a river. We can't do that.
I didn't want to say that people should be alarmed that just one little bit of virus could make you sick. It's simply that the way we don't get sick on a regular basis is by having a healthy immune system. And that if you block, you know, 3 viruses from coming out, but there's another 100 that are coming out, you haven't really helped yourself.
In fact, we're concentrating on something that's distracting us from doing the right things to help people.
Yeah, and you were saying that if we really want to do something, because I think part of what's going wrong is Americans really want to do something, so they think they're helping everyone else by putting on masks. But you were saying that there's other environmental things that we could do, like UV light.
You know, I tell everybody this. First of all, vitamin D deficiency is what the Indonesian showed was critical. Only 4% of people in the Indonesian study that were sick in the ICU and dying had a D level above 30. Take vitamin D. You can't get it from the sun. Zinc, they just came out. 50% of the people that are very sick with this have zinc deficiency. This is, again, simple to do. You know, good food, clean air, but humidity, the absolute humidity is the #1 predictor of flu outbreaks. So humidify your house, fresh air.
And I want to emphasize, I stand with you in solidarity about what we're doing to our children. It's very destructive to the children's mental health, well-being, and also just the creating of fear in our children. So thank you so much for bringing up that last point. Thank you for being here.
He said, sir, excuse me, sir, you've just tested positive. I said, tested positive for what?